Hello, everyone. Thanks for joining us today for our expanded telemedicine provider information session. This is April 6, 2020. My name is David Valentine from the Oregon Health Authority, and joining me today is...
Hi, I'm Tiffany Regan, and I work in Oregon Health Plan Communications for the Oregon Health Authority.
Thank you, Tiffany. So we're going to go ahead and jump through some slides with you today. We've got a lot of information to go over, a lot of information that you folks have been asking about. So we're hoping that this can help you guys settle some issues that have been floating out there and give you an idea of the direction we're headed on telemedicine. So next slide here is kind of what we're covering today. We've got a bunch of resources and definitions. We're going to have kind of showcasing the expanding coverage that we have due to COVID-19. We're going to detail some of that coverage. We're going to talk about the changes for modes of delivery, location of services, how verbal consent can be used, documentation, and rates, billing, and codes as well. I know we've gotten a lot of questions about that piece. We're also going to highlight some helpful links. We've tried pretty hard to get some resources online for you folks to be able to grab 24/7 and reference. So we're going to be kind of walking through those. Quick notes, too, for those of you who may have staff who couldn't join us right now. This webinar will be posted as well once it's been completed, and we will be able to, you guys will be able to access that offline. Also, we're going to have some questions, and you guys can ask questions at any time during this webinar. We will not be answering those live today, but we will be capturing all of those questions, and we will follow up with you guys as soon as we can with more FAQs that we'll post on the website. And take a look here at the slide we have up now. This is an important telemedicine resource page. This kind of details the page for providers and health plans. This is dedicated exclusively to COVID-19 information, guidance, updates, reference material for providers and CCOs around telemedicine, or excuse me, around COVID-19. And again, any telemedicine updates too, we're going to put here. Also, we have an email box that we are using to kind of funnel all of our COVID-19 questions for providers and CCOs. So if you have questions, go ahead and add this to your address book, make it a contact, covid.19@dhsoha.state.or.us, and we will work quickly to post Q&A at the site listed above. Okay, let's move to the next slide here, definitions. So telemedicine and telehealth are used interchangeably by the Oregon Health Authority. Telemedicine and telehealth includes two-way video and audio communication, phone calls, whether billed using ordinary codes or specific telephone codes, services such as secure messaging provided through online tools such as provider portals. In this presentation, we will be using the term telemedicine. Also, that's going to be populated a lot in our ongoing guidance and some of our materials that we move forward. So telemedicine, grab onto that. Okay, I'll give it up over to Tiffany.
Thanks, David. So let's talk very briefly about what we're doing to expand telemedicine. So OHA is expanding coverage of telemedicine and telephone services in light of the COVID-19 outbreak. And what does that mean exactly? It means that licensed healthcare providers can provide and bill services that are provided through the use of telemedicine. These services must be performed within the provider's scope of practice as governed by their licensing board and, as applicable, provider qualifications described in OER. So what's changing? Providers are allowed to use several modes of telemedicine delivery, including telephone, and we're going to talk about them specifically later on. Telemedicine services are available for all conditions, not just those related to COVID-19. That's an important call out. Both existing and new patients can use telemedicine services. This is true even for codes that say established patients. Payment parity will enable providers to increase capacity and accommodate telemedicine service delivery. Those are quite a few changes, but it's going to help Oregonians access the care they need during this national emergency. Let's talk about modes of delivery. So we've been getting quite a few questions about these. In order to make it as accessible as humanly possible, the federal government is enforcement discretion around HIPAA privacy requirements. And if you're interested in more specifics, you can follow this link to the actual notice. Examples of communication platforms that can be used if a compliant platform is not available include FaceTime, Facebook Messenger, Google Hangouts, Zoom, and Skype. We want to make sure that public-facing applications like Facebook Live, Twitch, and TikTok are not used. Okay, let's talk about where you can provide services. So providers can now provide services from their own home or another setting that supports a private interaction. Restrictions have been removed, so patients can receive services in a hospital, in their own home, nursing home, or another location. So we've gotten a lot of questions about verbal consent. We want to briefly go through the new guidance, and then we're going to talk about documentation. For both new and established patients, providers should get verbal consent for telemedicine services. So patients who receive online, video, or telephone services can consent verbally as long as cost sharing is clearly disclosed. Requirements for language access, interpreters, translation services, those all still apply to telemedicine services. So make sure you're following those. All right, David, let's talk about documentation.
Thank you, Tiffany. That's a lot of great information. And so this ties directly to documentation as well. So you want to document telemedicine the same as an in-person service. You know, we're expecting to continue to document the services they're providing to the best of their abilities, including client responses, treatment plans, and assessments. You can refer to the Governor's Executive Order 2012, which encourages medical offices to engage in social distancing. Social distancing should be included as the reason for not having signatures in writing. You can try to gain written consent after the fact as well. So our standards for documentation remain the same. Medicaid and behavioral health program rules describe standards that providers are expected to adhere to when delivering services, regardless of the modality. And there's a couple of OARs there listed at the bottom for reference as well. Now we're going to talk about rates. Services delivered using a telemedicine or telephone platform will be paid at the same rate as an in-person service. So I really want to call that point out. We have had a ton of questions about that. We really want to make sure that everyone connects with. TCOs have been directed to reimburse contracted providers for covered services at the same in-person rate. OHA has not directed CCOs to reimburse at the fee-for-service rate. Non-contracted providers will be reimbursed at the rate agreed to between the plan and the provider, or the OHP fee-for-service rate, whichever is higher. For billing, it will be made retroactive to January 1st, 2020. The telemedicine services need to meet a few qualifiers to be eligible, and these are listed below. Telemedicine coding requirements are already in existing rules and guidelines. Below are some resources for you to stay up to date on any of the changes that are made. It's also important to note that the A5 will be updated later this week. COVID-19 codes. We have some special codes for our COVID-19 work. All Oregon Health Plan providers who submit professional or institutional claims need to add the following codes for each service related to COVID-19 prevention, identification, diagnosis, or treatment. Now, please report these codes for COVID-19 related services in addition to any other codes required by your program-specific rules or guidelines for the services billed. For physical health providers, all telemedicine services should be billed using the O2 place of service. You may bill for the services retroactive to January 1st, 2020, but please allow up to 2 weeks for OHA to make system changes to support billing. For behavioral health providers, please provide telemedicine services using audio-video platforms when able, and utilize the GT modifier for the codes identified on the behavioral health fee schedule. When audio-video platform is unavailable or there is limited to no access, providers can offer services using the telephone, but you need to use the place of service 02 without a modifier. For oral health providers, we ask that you please provide teledentistry services, including telephone calls, with audio-visual capability, and services such as Skype, FaceTime, or Google Hangouts if a HIPAA-compliant platform is not available. Reimbursement will be the same as for services provided in person. Place of service 02 is required, but modifiers are not, as ADA forms cannot support them. We have a few special codes, certain codes that specify telephone or digital online evaluation and management not related to a recent or upcoming visit. We'll pay close attention to this section here, where we have these split between telephone and online digital. So we have some options here for quick check-ins. G2012 can be used for quick check-ins by phone and video evaluation and management. So what is this? This can be used for brief communication, technology-based services, virtual check-ins by a physician or other qualified health professional who can report evaluation and management services. This should be provided to a patient not originating from a related EM service provided within the previous 7 days, nor leading to an EM service or procedure within the next 24 hours or soonest available appointment. It generally is about 5 to 10 minutes of medical discussion. You should note, too, that the established patient requirement for this is not being enforced at this time.
Thanks, David. So now we're going to jump into some questions that we've been getting. The first one is, can providers use only telephonic communications for treatment and billing purposes? So telephonic communications can be used only if audio-video communications are not available or if it's refused by the patient. Providers should use the richest, most secure platform that's available to them and the patient. Our next question, how should providers handle a release of information via telemedicine? So if both parties consent, calls could be recorded as evidence. Oral consent to release information is needed for safety reasons and can be documented after reading the ROI language to the client. And that can be followed up with a written version by mail, as long as you provide a self-addressed stamped envelope. So that gives the client an actual opportunity to rescind or limit. And just a quick reminder, if these steps are used, it should definitely be documented. All right, here's some additional questions. So what organ administrative rule covers telemedicine? We have a link here. So you can just go right out to the Secretary of State's website if you need to see it. Where do I find OHA provider memos about telemedicine? We just want to reiterate that we have the COVID-19 page for providers and health plans. It has all of our memos, updates, and other guidance. It's a really good resource. Can peer-delivered services be provided via telemedicine? The answer is yes. The Behavioral Health Fee Schedule, it identifies all peer-delivered services that can be provided through telemedicine using the GT modifier. Go ahead and check out the Peer Support Services tab for this information. And our last question, are skills training services via telemedicine allowed? No. So skills training via telemedicine is actually not covered. All right, so we also have a list of helpful links. We have our provider fact sheet that covers coverage changes and has billing codes. We have telehealth guidance from DCBS and OHA combined. We have our OAR, our prioritized list of health services, guideline note, statement of intent, and a link out to the fee schedule. So this is just the start of some helpful links we wanted to share with you, but go ahead and check out the COVID-19 provider and plan page for more information. Okay, David, what are our next steps?
Thanks, Tiffany. For next steps, OHA is requesting additional telemedicine authority from CMS. We're trying to assure that continued access to services for covered members can be expanded and we can keep looking for opportunities to serve our members. We will continue to communicate any services that can be provided via telemedicine that are not currently available. If you have any questions after the webinar, feel free to look on our CCO and provider webpage we set up for COVID-19 related questions. If you still can't find what you need, send us an email at the COVID-19 email box listed on this slide. We're going to also work quickly to post our Q&A results at the hyperlink below.
All right, thank you so much for joining us today. Please do be on the lookout for additional webinars in the future covering telemedicine and other topics related to COVID-19. Thanks very much and stay well.